Hello, everyone. So like Paige said, there we go. I have been spending the past 2 years at Brandeis University getting my master's in genetic counseling, and I did my thesis on genetic testing in Rett syndrome and all of your experiences with it. And I had a couple of genetic counselors on my committee, a geneticist at Children's Hospital Boston, and Jennifer Endres, who I'm sure most of you have had contact with in the past. So the first thing is, not everyone who has a child with Rett syndrome has had genetic counseling, so you might not be familiar with what that is. We are trained to go through and really help families who have a child or maybe themselves have some type of genetic disorder. We go through family histories, medical histories. We're trained in genetics, so we know a lot of the stuff that Dr. Percy just talked about as far as the real hardcore science part, but we also are trained in counseling to kind of help families talk about what's going on and make the best decisions they can for their family regarding testing. There we go. So like Dr. Percy was just saying, there's two types of diagnosis for Rett syndrome. You can get the clinical diagnosis based on the features that your daughter has, or you can get the genetic diagnosis based on the genetic testing, a MECP2 mutation or deletion. And another thing he pointed out, which was really critical for my study, is that if you have a genetic diagnosis, that doesn't mean that you have Rett syndrome, and it's not required to have a genetic diagnosis in order to be diagnosed with Rett syndrome. So in genetic counseling, a lot of disorders like Down syndrome or something similar, you only are diagnosed with that if you have a positive genetic test result that says that's what you have. But some conditions like Rett syndrome are just diagnosed based on clinical criteria, even though they are genetic disorders. So there's been a lot of research on how genetic testing affects families who don't have a diagnosis, and then when it's developed, they can go and get testing and they get a diagnosis. But there hasn't been much research done on the experience of parents who have a diagnosis already, and then this other form of a diagnosis comes out for them to get. So in a study done by Dr. Percy a few years ago, he found that 60% of individuals with a clinical diagnosis of Rett syndrome had gone on to get testing. So I was kind of wondering, okay, why did the other 40% not go on to get testing? So the study purpose was to assess the impact that this genetic testing had on you, parents, and families, and what factors made you either decide to pursue testing or decide that you weren't going to pursue testing. So I created an anonymous online survey, sent it out through the IRSF networks. Most of you are probably a member of at least one of these, the RettNet listserv, the Facebook page, or you get the IRSF flash emails. I had it available between December and January, so a total of 6 weeks, and it had multiple choice questions which I analyzed using a statistical software package. And then there were open responses where you could kind of write your own thing. You didn't have to select an option, and those were coded for themes using a different type of software. And then I split parents into two groups. So I split parents into whether their child was diagnosed clinically before or after the testing came out, which was in 2000. And then I also split you into whether you got testing, so yes or no. And then I used these groups of parents to compare their answers to each other to see if there were all the people who were diagnosed before the test came out and didn't get testing had different responses than those who had testing and were diagnosed after. So overall, 239 of you participated in my study, and most of you were mothers with one affected female child, which would be expected knowing what Rett syndrome is like. I had people respond from all different regions of the US and Canada, and there were 29 who responded from outside these two countries. So my big findings were that most of you have had genetic testing at this point. I found 91%, as well as 61% of you have had actually a genetic test done before you got the clinical diagnosis of Rett syndrome. So overall, that kind of made me decide that maybe genetic testing is actually starting to replace the clinical evaluation as the first type of diagnosis. In the past, you would have the clinical and then you'd go and get the genetic to kind of confirm it. But now I'm finding that more people are actually getting the genetic first, maybe earlier on in the process before your child has developed enough symptoms to fit that clinical criteria. Another thing I found was that a lot of you said that you trust and you value the genetic diagnosis more than the clinical diagnosis. And that's important for us as genetic counselors and other health professionals to know that this is something that you actually trust more and you really want to have in your pocket when you go to talk to insurance or something. And finally, testing either had no real effect on you as parents, it didn't really change the way you view your daughter or deal with her care, or that it really gave you a sense of closure, that you were more comfortable knowing exactly what your daughter had, exactly what the mutation is. So the second thing was to look at the factors that were important in parents to obtain testing. And I compared my top 5 results with the top 5 results that the IRSF has published in some of their publications. And the first 2 are actually the same as in both studies. Parents want to confirm the clinical diagnosis, and you want to learn more about Rett syndrome and what your daughter has. The other 3 things that you as parents said were most important to you in my study were the fact that your doctor was interested in getting testing for your child, obtaining better services for your child, maybe getting insurance to pay for more things because you had a known diagnosis, and identifying peer support, so identifying the people you're sitting next to and knowing that they're going through the same thing. The IRSF, the other 3 options for them are a little more research-based, which makes sense. They're trying to promote research, and they get all of you here to hear what's going on every year. So they're all good reasons. The third thing I wanted to look at were the barriers to testing. So what do parents who don't get testing think is important, and why do they not get testing? And the first 2 things, the availability of the test, so like Dr. Percy was saying, some doctors are saying, well, there's no cure, there's no reason to do testing, we know what your child has. That has actually prevented some people from getting testing. And another big issue is the cost or the lack of insurance coverage for the testing. A lot of parents who have a child who's older, maybe 12 or 13, and had a clinical diagnosis for years before the genetic diagnosis was available, have been using Rett syndrome as their reason to have insurance pay for all this extra treatment. And the insurance will only cover a diagnostic test. So the insurance will turn around and say, you've had a Rett syndrome diagnosis for years, we're not going to pay for this testing now because you already have the diagnosis. So those 2 things could be something that we as healthcare providers try to work to change over time. The third thing was the child's age. 62% of you who did not get testing actually had a child who was born before the testing came out, was diagnosed before the testing came out. So that indicates that those of you with older children have not gone on to get genetic testing yet. So in conclusion, if genetic testing does become the primary method of diagnosis, we as healthcare providers have to kind of approach cases of Rett syndrome a little bit differently. Right now, as genetic counselors, we get trained to basically go in and review, okay, when did your child start developing their hand-wringing movements? When did they start to regress in some of their skills? And if we're doing the genetic diagnosis first, we're going to have to start having you come in and saying, okay, this is what you can expect to see in the next 2 or 3 years with your child. So it's a little bit different approach we're going to have to start learning how to do. The other thing is that we have to offer testing to every family, doctors, anyone, even though there's no cure right now, that could be coming, and it does provide a sense of closure and really does make all of you feel a little bit more comfortable with the diagnosis having that clinical genetic mutation there. Also offering testing to those especially who had a clinical diagnosis for years. You still might want to get testing and you just can't afford it right now. Offering genetic testing before the clinical diagnosis is established might increase the chance that insurance is covering it. And from my data, it looks like a lot of doctors are kind of moving towards that anyway. And the last thing is to look into alternative funding for some of these families who really can't find a way to get genetic testing without having to pay for it. So those were my big results. I want to take this time to thank all of you for sharing your experiences and your stories and your opinions on everything. It really was very helpful, and it's very important for us as healthcare professionals to really hear back from the patients and the parents to hear how our services are helping you or how they can be improved. And that's the only way it's going to get improved. And I also wanted to let you know that I've actually given this talk twice already to different groups. So the word is definitely getting out there. And I just want to thank all of you very much.